Stamp out smoking. Do you realize how many people die on average each day from tobacco smoke? Between 1,178 and 1,192. Despite the fact that nearly half a million Americans die prematurely from tobacco smoke and secondary smoke each year, and many more become seriously ill, the more tobacco companies appear to be unconcerned. Even with the facts, people still look to cigarettes to solve problems like physical depression, social support, stress, and many others. A stroke is one of the most devastating illnesses from both a physical and mental standpoint. It is the third cause of death of Americans behind only heart disease and cancer. Smoking can be a significant cause of stroke. Strokes occur when blood vessels carrying oxygen to the brain clogs or burst. Nerve cells die within minutes, causing the part of the body they control not to function. Active maternal smoking during pregnancy is recognized as the most important preventable risk factor for adverse birth outcomes. Since 1984, one of the 4 current cigarette label warnings has been pregnant women who smoke risk fatal injury and premature birth. Recent medical findings support the warning and other smoking-related dangers of women and or children. The U.S. Centers for Disease Control reported in August 1992 that women who smoke while pregnant are more than twice as likely to deliver underweight babies as mothers who do not smoke. About 3,000 teens light their first cigarette each day, with the average starting age being 12. When faced with the question, why do you smoke, most teens are unable to answer the reasoning. Most teens will answer that they want to be more sociable and accepting by peers. The simple answer is that they enjoy it, but the simple solution will be for schools to take field trips to various nursing homes and hospitals so teenagers can see the patients who have been ravaged by the toxins of poisonous tobacco smoke. The field trip could be a part of a health education course focusing on the dangers of drugs, alcohol, and tobacco. School administrators and school boards should be advised of the importance of the need to promote a smoking education program. Smoking on the premises by students as well as faculty, which sets an example, should be banned. The community should reach out and offer community-wide programs to prevent smoking. These effects vary and including various print and electronic media to reach a broad community. Use specific targeted programs and targeted community leaders and organizations to change community practices in specific ways to reduce tobacco uses. Community programs can reach adolescents who are missed by school-based interventions. Community programs report equivalent reductions in tobacco use for use at different levels of risk. Community interventions can also help change community norms or practices that are relevant to adolescents' tobacco use. While the communities are reaching out and doing their part, the parents should be at home supporting as well. Parent awareness must be an early step in dealing with an underage smoking problem. These are steps parents can take to try to persuade teenagers from engaging in the unhealthy smoking and chewing tobacco habits. Although the tobacco industry denies trying to appeal to kids, their arguments are almost convincing as they're contending that tobacco smoke and secondary smoke is not harmful to one's health. A famous quote by King James I is that smoking is a custom loathsome to the eyes, hateful to the mouth, and harmful to the brain, and dangerous to the lungs. So before a person decides to smoke and end their lives, they better think twice. The end. Have any questions?
Why did you choose to do your presentation on smoking?
I chose to do my presentation on smoking because my father used to be a smoker, and I kind of use these facts to persuade him not to smoke. So I feel like if I can reach out to him, I can reach out to anyone.
What are some of the ways parents can persuade their children not to smoke?
They can persuade their children not to smoke by telling them that most people won't hire smokers, and that normally smokers' clothes are dirty and smelly, and their teeth yellow, and their fingernails yellow and stained, and that their clothes and I said that already, and that their skin sags and wrinkles a little earlier than normal.